Hi guys, welcome back to HAG Studios. For those of you who are regular viewers of our YouTube channel, you will recall when we spoke with Dr. Adrian Mitchell on women's health, we told you that we would have Dr. Bill Aiken to talk on men's health. And I have him here with me today. I'm actually sitting in his garden. So I'm happy that you have us in your garden, but welcome to HAG Studios.
Thank you, Phil, for inviting me to HHG Studios. I look forward to participating on your program.
Oh, thanks. Okay, Dr. Bill. Can I call you Dr. Bill?
Absolutely, Faye. Absolutely.
Okay. For years you wrote on men's health for our magazine, HAG magazine.
That's right.
So I know you know your stuff. And as a consultant urologist, you know a lot about men's health. So we're here to learn today about everything about men's health.
Right.
What are the main concerns that men come to you with?
Okay, so in Jamaica, prostate-related issues are a major cause for men coming to the urologist. And there are three conditions that affect the prostate. Prostate cancer is one, a condition known as BPH, which is really non-cancerous enlargement of the prostate, is another one. And there is what is known as prostatitis, which is an inflammation of the prostate.
Can I just ask you, tell us exactly what is a prostate?
Okay, sure. So the prostate is a gland that sits right at the base of the bladder, deep within the pelvis. It is situated right behind the pubic bone, which is at the base of the penis. And it's sandwiched between the pubic bone in front and the rectum behind.
Okay.
But the function of the prostate gland, it is considered an accessory organ of male reproduction. So it contributes around 20% to the semen when a man ejaculates. And that contribution is very important because that 20% contribution to the semen has nutritive factors that support the sperm. It has important factors such as prostate-specific antigen that liquefy the semen. It has antibacterial factors that prevent infection. So it's very important in terms of reproduction. It is not essential for life, but because of its location around the origin or the beginning of the urine passage, whenever it becomes enlarged, it may cause a constriction to the flow of urine, and that may result in symptoms, as we commonly see in men who have an enlarged prostate.
The enlarged, in Jamaica, I remember hearing the word boson.
Right.
Is that what that is?
No.
Okay.
Boson refers to a hernia.
Okay.
Which is a protrusion through a defect in the body wall.
Okay.
So commonly men will have an inguinal hernia that presents in the groin.
Okay.
And it may go down into the scrotum, and that's what's commonly referred to as boson.
Okay. Okay. Yes. All right. We got that all clear. So how does, you said it's the prostate, you have all of these issues with the prostate, and it usually starts about, is it just mainly in older men?
No, not necessarily. So as I said, there are three conditions that affect the prostate. So both prostate cancer and BPH tend to affect older men, and the prevalence of these conditions increases as men get older, because as a man ages, his prostate becomes larger with age. And also the incidence of prostate cancer increases with age. But prostatitis tends to affect relatively younger men. So prostatitis, there are different types of prostatitis, and itis stands for inflammation, so it's really an inflammation of the prostate gland. But the most common type of prostatitis is characterized by pain, a lot of pain, So men may have pain when they ejaculate, or they may have pain between the scrotum and the anus, where we call the perineum. They may have testicular pain. Pain is a prominent feature of prostatitis.
Okay.
And that tends to affect younger men. So it depends on which one of the three prostate conditions we're talking about. Of course, prostate cancer is the most feared condition because if left untreated, it can result in death. And as I said, prostate cancer accounts for the leading cause of cancer-related deaths in Jamaica. So it is the number one cause. And of course, we, as urologists, try to promote screening, where we try to promote the early detection of prostate cancer through tests such as prostate-specific antigen to try and decrease the death rate from prostate cancer.
Are men taking that up?
Not to any significant degree. I think the message certainly is out there, but I think the men who have accepted the message and have responded to the message are mostly those who are healthy, are already well aware, practicing good health practices, and so we're not really making a dent in prostate cancer deaths.
So do you find that men generally come to you when it's far gone because they're really experiencing serious symptoms?
Absolutely. So men traditionally do not have a good health preventative behavior. So unlike women who go to the doctor and get their regular pap smears and mammograms and so on, men traditionally do not have that sort of preventative health behavior. And so what we find is that a lot of men come when they have symptoms.
Yes.
And like with a lot of conditions in medicine, whenever you have symptoms, it indicates an advanced state of the disease. And unfortunately, in this advanced state, in many cases, we can no longer cure the disease. We can only control it for a period of time. So this is one of the reasons why the death rate from prostate cancer is so high in Jamaica, because not enough men are taking up the message to screen. They are waiting until they have symptoms, and when that happens, they're generally too late.
Okay. What are these tests like?
Okay, so there are two basic tests that are involved in screening for prostate cancer. One is a blood test called the prostate-specific antigen blood test, or PSA for short. PSA, as I mentioned earlier, is one of these substances that is secreted by the prostate gland. And the natural role of PSA is to liquefy semen, to keep it in a liquid state, so that when a man ejaculates, the PSA is responsible for keeping that semen in a liquid state so it flows freely in the female genital tract. Whenever there is any problem affecting the prostate, and it doesn't necessarily have to be prostate cancer, anything at all that affects the prostate, what happens is that PSA leaks into the blood in increased quantities. And so we test the blood to determine if there's anything wrong with the prostate. So that's one of the tests that we do. A simple blood test to check the blood level of the prostate-specific antigen. The other test that is recommended that complements the PSA is the well-known digital rectal examination. And digital not meaning electronic, but digital simply meaning
the finger.
A digit. And so in that test, what the doctor does is that the doctor uses his or her gloved and lubricated index finger and feels the surface and consistency of the prostate. And essentially what we're looking for is whether there are any abnormalities on the prostate gland. Basically, we're looking to feel if there are any hard areas like my knuckle in the prostate that would suggest the presence of cancer. So these are the two basic screening tests, a blood test and a rectal examination. Unfortunately, a lot of men stay away from doing either test because they don't want to have the rectal examination done.
So are they always done together, or could you just do the blood test?
They ought to be done together, but we don't turn men away if they want to do just the
blood test.
Right. So we're not going to turn any man away, but
Okay.
we will let them know what the limitations are in just doing one. So if either of those tests is abnormal or both are abnormal, then the man would then go on to having a biopsy, which is where we take a pinch of tissue from the prostate to determine whether cancer is present or not. Nowadays, we commonly precede the biopsy with what is known as a multiparametric MRI. That's just a big fancy word for a special imaging test that allows us to accurately determine if there are any abnormal areas in the prostate, and we tend to target those areas when we do a biopsy.
Okay. These tests, can they be done at a general practitioner, or do they always have to go to a urologist like yourself?
No, they can be done by any registered medical doctor.
Okay.
Any doctor can perform a digital rectal exam and request a PSA blood test.
Okay.
So patients do not need to go to a urologist to have these tests done.
How can the men be encouraged to do this more?
So there are a number of things that I believe we can do. One is get the ladies involved. We find that when a lot of times the women are the ones who bring the men to the doctor kicking and screaming and insist that they do their health test. And
do they usually do it before, or they also wait until the symptoms are there?
No, well, the women
will do it before.
The women will insist that the men come before.
Okay.
And so they'll sometimes accompany them to the doctor to ensure that the tests are done. So I think if we have more of that, if we have more women participating in the health care of their men, I think it would go a far way to getting more men to come to the doctor.
Our audience is actually international. The problems with prostate, is this an international thing? Is it?
Yes, certainly. So worldwide, prostate cancer is the second most common cancer after lung cancer. In terms of the death rate international, it is not as high as in the Caribbean, because in fact the Caribbean and sub-Saharan Africa have the highest death rates in the world. But overall, prostate cancer is a third or fourth leading cause of death internationally. But in the Caribbean, as I said, it's the #1 cause of cancer death. So it is a problem.
We have to do something about that.
Yes.
All right, we're going to shift gears a bit, because we can't talk about men's health and not talk about erectile dysfunction.
Sure.
I remember you wrote a lot on that in the magazine.
Yes.
So let's talk about that. What is erectile dysfunction?
Okay, so erectile dysfunction, or ED for short, is the persistent inability to either get an erection or maintain an erection to the end of intercourse. And when this occurs over a period of time, typically 3 months, then men are said to have ED. In some cases, it may come on acutely, such as after trauma or some types of surgery, but generally it has to be present for at least 3 months for it to be considered an entity. It is very common. Studies have shown that 52% of men 40 to 70 years old suffer from some degree of erectile dysfunction.
Do you think people are aware of that? I get the feeling that men think they're having that problem and a few other men. Do you think they're really aware that it's so prevalent?
I think the availability of drugs like Viagra and Cialis and Levitra have caused us to be speaking a lot more about erectile dysfunction, and certainly we've seen a lot more men coming for treatment now. So I think men are aware that as they get older, the risk of erectile dysfunction increases, and we're seeing a significant proportion of men coming, a significant higher proportion of men coming for treatment now for erectile dysfunction.
And it starts in the 40s, you're saying?
It's so in terms of overall prevalence, it tends to be a condition that affects aging men. So in the 40s, the prevalence would be lower than for a man, say in the 50s and 60s, but it tends to become a problem around about that age. It may, although ED may affect much younger men, because psychological factors can cause erectile dysfunction, as well as persons may have hormonal problems or congenital problems that they may have been born with that may contribute to erectile dysfunction. But generally, we really see an uptake in the prevalence, men in their 40s and above.
Okay. And what can be done about that?
All right, so in terms of what can be done, we need to look at the risk factors for erectile dysfunction. The risk factors for erectile dysfunction are predominantly the same risk factors that cause heart disease. So physical inactivity, living a sedentary lifestyle is a risk factor for erectile dysfunction. Cigarette smoking is another risk factor. Uncontrolled high blood pressure, diabetes mellitus, high cholesterol levels or high lipids in the blood. These are the same things that cause heart disease that tends to cause erectile dysfunction. And in fact, severe erectile dysfunction is a barometer for your risk of getting a heart attack or stroke, because studies have shown that in men with severe ED, if left untreated, if the risk factors are left untreated, these men, a large proportion of them will go on to suffer what we call a myocardial infarction or a heart attack. And so good penile health is in fact good cardiovascular health.
Wow.
And so the same things that we would do to mitigate against erectile dysfunction are the same things that we would do to improve cardiovascular health.
But the medication that you give for heart disease and diabetes, those are known to cause erectile dysfunction. So
yes, so
what comes first?
So some of the medications we use to treat high blood pressure may in fact exacerbate erectile dysfunction. And so it is very important that when a man is being treated with these drugs, that we ascertain whether it's having an effect on his erectile function. And we can always switch medication to those that are less likely to cause erectile dysfunction. So that's a very important point that you make. But it's important to understand that hypertension in itself, high blood pressure, and diabetes, these in and of themselves can cause erectile dysfunction, and in fact are very common causes of erectile dysfunction.
Okay. What do you do about that?
Okay, so anybody who presents with erectile dysfunction, the first thing is to identify what risk factors that they have that may be contributing to it, and to correct these. So if a man is not, if he's physically inactive, we need to start to get him physically active. We need to start getting moving. Of course, he may have to visit a cardiologist first to make sure that he won't suffer any harm from engaging in exercise and so on. We need to know what his exercise tolerance is and so on. But physical activity is very important. There are many studies that have shown that just by engaging in physical activity, erections improve as a result of this. Then if the man is smoking, we have to stop him from smoking. If he has diabetes or pre-diabetes, because a lot of men we see are not necessarily diabetic, but they have abnormal blood sugars, or what we call pre-diabetic, and a lot of this is related to being overweight and obese. So dealing with the overweight and obesity is very important. And interestingly, when a man is obese, the obesity converts the male hormone testosterone to the female hormone estrogen, which contributes to the erectile dysfunction.
Really?
So treating the obesity is very important. We have to, if the man is under a lot of psychosocial stress, that is a very important factor, because the most important sex organ is in fact the brain. And if a man is under a lot of psychosocial stress, whether financial stress or job-related stress or relationship conflict and so on, he's not going to be able to perform. Also, we have to screen for depression, and a lot of these men have a level of anxiety, what we call performance anxiety, in that if a man has had a difficulty getting an erection in the past, on subsequent attempts at intercourse, he will have a lot of anxiety generated by what is known,
which makes it worse.
Which makes it worse. A typical fight or flight response, where you know, adrenaline and noradrenaline are secreted by the human body. So these are all things that need to be addressed. And having addressed those, then we typically would prescribe one of the oral agents available on the market. Viagra is well known. The generic name is sildenafil. There is Cialis or tadalafil, and there is Levitra. So any one of those can be prescribed, along with doing all the other risk modifying things that we mentioned.
Do these things affect the heart?
What things specifically?
These medications, this Cialis and Viagra.
If a man has angina and severe angina, and he is taking medication.
And by angina you mean?
Angina is a condition in which the blood supply to the muscle of the heart is compromised. So whenever a man engages in activity and the heart has to work more, you get chest pain as a result of that, because not enough oxygen is being delivered to the muscles of the heart. So if a man is on medication called nitrates for that, then drugs like Viagra and Levitra and Cialis are absolutely contraindicated in persons who are taking those medication, because it may cause a precipitous drop in blood pressure, and persons may die as a result. So we don't prescribe these drugs in persons who are taking those medication. I hasten to add, though, that most of the patients who died as a result of taking these drugs, is not the drugs per se that caused them to die. What happened is that men had severe exercise intolerance. These are men who had not had sex in a long time, men who could hardly climb 2 flights of stairs without getting chest pain. And so these men went ahead and took the drugs too. And of course, when they engaged in the physical activity related to sex, their hearts couldn't deal with it and they died. So it's not the drug itself that caused them to die. It was the poor exercise tolerance that they had because of the severe heart disease that they had.
Are persons taking these drugs without them being prescribed by a doctor?
Unfortunately, that is a situation that we see. It is said that you can get these drugs on the street, downtown, and at certain gas stations you can get them.
Wow.
And they are not the standard drugs. These are generic drugs that are sometimes produced in somebody's backyard in India or China, and
Okay.
and of course you're not sure exactly what you're getting and the dose you're getting. And the other thing is that sometimes men combine these drugs with things like Red Bull and other things, and we've had a number of people die as a result of combining these drugs with energy drinks and so on. So there's a lot of unregulated.
And then you combine the enthusiasm with all of that, and it's a mix that is
correct. It can
detrimental.
It can be potentially lethal.
Okay.
But
okay.
when prescribed, they are safe drugs once a doctor does not prescribe it in the limited set of patients who should not get it.
Okay. How can partners help men who are having this problem? Do you find that the men withdraw when that happens, and sometimes they're misunderstood?
Sure. So I'm glad you asked that question because when a man is unable to perform sexually, he sometimes withdraws, as you said, and women may misinterpret this.
Yes.
They may, in some cases, they may think the man is being unfaithful. They may think that they are no longer sexy, and there may be recriminations occurring as a result of this. So it's very important that the lines and channels of communication are open between partners. And we find that women who are supportive of their partners and who encourage them to come to the doctor and who are engaged in the whole rehabilitation of their partners, that these men do better than when the partner is not involved. So it's the partner actually plays a key role in being supportive, in not ridiculing the man or thinking that he's having an affair or anything like that.
But don't the men sometimes, when they're having this problem, think that the women are attracted to other men? Do you find that as well? So they kind of start now to accuse the women of being involved otherwise, because
they don't necessarily accuse them, but of course they are concerned, because if there are especially men who may have wives who are a lot younger than them, they obviously will become very concerned, because if they're not able to perform sexually, then they will wonder if the frustration that their wives are experiencing, they'll relieve that frustration outside. So yes, men do have genuine concerns, but to say accuse their female partners in the absence of any evidence, I don't know that happens. But of course, and the good thing is I've seen a lot of women insist that the men come to the doctor and get it sorted out, so because they care about the relationship and so on.
And there are things that you can do to help.
Absolutely. And we mentioned them earlier, dealing with all the risk factors that contributed to the ED in the first place. So getting the man to start exercise, changing his diet, controlling his cholesterol, making sure his blood pressure is well controlled, and so on. All of these are important. We mentioned the importance of stress, and getting the female partner engaged in the whole process is important.
So, if medication doesn't work, are there other things that you can do as a urologist to help?
Absolutely. So the good thing is that no matter how severe the erectile dysfunction is, there's always an option there for treatment. So if controlling the risk factors and treating with oral medications don't work or don't bring about a satisfactory result, then we can teach a man how to use what is called intracavernosal injection, which is a big word simply meaning injections within the penis. So we can teach a man how to give himself very small injections of a substance that will increase the blood flow into the penis. And this works very well.
Oh, is it common?
It is quite common, and it is
Oh.
readily available in Jamaica.
Okay.
It's called Trimix, and what it does, it's a compounding of 3 different agents that independently act to increase the blood flow in the penis. And this works in the majority of men. An alternative is a vacuum erection device, or what is known colloquially as a pump, which is a cylindrical device that the man places over the penis, activates a pump that causes a vacuum that sucks venous blood into the penis, and once the penis is engorged, circular device is placed at the base of the penis to trap blood within it. And this gives an erection for approximately half an hour. But I find a lot of Jamaican men do not like that because it's cumbersome and so on. But the injection is readily available. If neither the injection nor the pump works, then we may recommend what is called a penile implant, which is a surgically placed device within the penis that allows a man to press a button and get an erection.
Where's that button?
That button is placed in the scrotum.
Okay.
It's placed in the scrotum. So
That's interesting.
it's a 3-component device. You have a reservoir with fluid that's placed behind the tummy. You have the inflatable penile prosthesis or cylinders that's actually placed in the penis itself. And then there's a control knob that's placed in the scrotum. And men who have this procedure are highly satisfied.
Okay.
There are high degrees of satisfaction.
Is ejaculation the same with all of these things?
Yes, it doesn't affect. So ejaculation is a completely different physiological.
Okay. So it takes place when you have all of these.
Sure, absolutely.
Okay.
In fact, you don't need an erection to ejaculate.
Okay.
It's a different physiological process. And speaking of ejaculation, that's yet another condition that premature ejaculation in particular. That's another condition that men frequently present with, and that there are treatments that we are able to give to satisfactorily combat this problem. So that's another common reason that men present.
Usually younger men for this, or?
Yeah, typically younger men. Typically younger men. But I don't want us to
Yes.
think that men's health is all about sexual and reproductive health, because men also suffer from severe depression. Men are more likely to commit suicide. Men are more likely to engage in behaviors that in violent behaviors, and men are more likely to be involved in road traffic accidents. So when we talk about men's health, it's a very broad topic.
Yes.
That we shouldn't reduce to genital or reproductive health.
Yes, or heart.
Yeah.
Dr. Bill, this has been so much to take in, very interesting. I think we're going to have to do a second one, because
definitely.
then we can go into more on men's health, other than sexual and reproductive. Yeah. But thank you so much. I really felt informed, and I'm hoping that our viewers will find it very interesting as well.
Yeah, thank you for having me, Faye, and thank you to your viewers for, watching this. I think it's important for such as these to inform the public about men's health.
That's so true. That's so true. In What's Growing in My Garden this week, we show you a vivid amaryllis from Beverly's Garden in Jamaica and a quiet night blooming cereus adding fragrance to Stella's Garden in Cyprus. Remember to send us pictures from your garden. Email us at hagmagazine1@gmail.com.